so sadly, people are feeling pain. Pain in paying their bills, pain in running their company, and so that certainly permeates. But I tell you what I hear about just as much, and it's the potential cuts to Medicaid. What it would do, first of all, for healthcare generally. I mean, Medicaid covers the people we love the most, our parents and our kids. 50% of Kentucky's kids have some Medicaid coverage. 70% of our long-term care costs are covered by Medicaid, and rural healthcare is supported and cannot exist without Medicaid, and at its current level without expanded Medicaid. So imagine if you live in rural America and they do these cuts, your hospital system, which is your number 2 employer behind the public schools, shuts down. All those jobs are lost. It hits your economy, but then you, whether you have private insurance or Medicaid, have to drive an hour or 2 for your appointment, for your parents' appointments, for your kids' appointments, to see the same doctor who lost their job in your town in a bigger city.
Of Vermont's 650,000 residents, 400,000 have adequate health insurance, either through their place of work or through Medicare. When they need health care, they can go to the doctor or hospital, and their copay is affordable.
But for almost 250,000 Vermonters, the copay or annual deductible is so high, or their income so low, that they cannot afford to see a doctor or go to the hospital. As a result, they often put off seeing a doctor until an illness has become more serious and more expensive.
Hundreds of thousands of Vermonters are like a person furiously paddling in a large ocean, barely keeping their heads above water.
One big ripple of water will pull them under, and then they will be inundated with medical bills they can't pay, with bankruptcy often their only way out. But, of course, if they can't pay, someone must pick up the tab. Either healthcare providers must cover the cost, or more often, private health insurers raise their rates and make up the difference.
Now, the U.S. House of Representatives has passed a budget resolution that effectively mandates $880 billion in cuts to federal Medicaid funding over the next 10 years. If this resolution becomes law, Vermont will receive more than 20% less money for Medicaid.
Vermont's healthcare system cannot absorb that hit to its healthcare resources. Some rural hospitals that are already in peril will close, putting greater strain on the remaining hospitals and clinics, and leading to a higher rate of people going without basic health care. Private insurers will raise rates to cover the share of fixed costs currently paid by Medicaid. Many Vermonters will receive no health care at all, or be treated only when an illness or injury is severe enough to go to the emergency department.
Let me illustrate with a story. Sarah had always been the resilient one. At 42, she managed a small cafe, raised 2 teenagers as a single mother, and somehow kept everything together with a smile. She had health insurance through her employer, but with a $4,000 annual deductible and 30% copays after that, she treated doctor visits as luxury items.
The headaches started in February. Not terrible at first, just a dull pressure that aspirin could usually handle. By April, they were coming more frequently, accompanied by occasional dizziness. "Mom, you need to see a doctor," her daughter Jenna insisted one evening when Sarah had to lie down in the middle of dinner preparation.
"It's just stress," Sarah replied, massaging her temples. "And even if I went, that's at least $200 I don't have right now."
In May, Sarah started having trouble finding words occasionally, brief moments where common terms seemed to vanish from her vocabulary. During a morning rush at the cafe, she suddenly couldn't remember how to operate the register she'd used for years. Her colleague Marcus noticed. "Sarah, something's wrong. This isn't like you."
"I know," she admitted, "but I've already put $600 toward my deductible this year for Jenna's sports physical and that urgent care visit when Tyler had strep. I can't afford another bill right now."
By June, Sarah could no longer ignore the symptoms. During a parent-teacher conference, her right hand went numb and her speech slurred briefly. The school nurse urged her to go to the emergency room immediately. The diagnosis was devastating: a brain tumor, already substantial in size. "If we'd caught this 3 or 4 months ago," the oncologist told an attending nurse, "we would have had many more treatment options. The location and size now makes surgery much more complex."
Sarah's treatment would ultimately cost over $200,000. Her out-of-pocket maximum was $8,000. Money she didn't have. The cafe had to hire a replacement manager during her extended leave. Her teenagers learned to cook, clean, and manage household finances while their mother underwent aggressive treatment.
A year later, Sarah sat in her oncologist's office reviewing her progress. The treatment had been partially successful, but she would face ongoing therapy and monitoring for years. Her cognitive functions had been affected, and she could only work part-time.
"I keep thinking about those headaches last winter," she told her doctor. "If I'd come in right away."
"You're not alone," the doctor replied. "I see it frequently. People avoiding care because of cost until something becomes an emergency. It's ultimately more expensive for everyone: the patient, the insurance company, society, and often with worse outcomes."
Sarah is like the person barely keeping her head above water in a sea of financial problems. If the Medicaid cuts that the U.S. House requires in its budget resolution become law, there will be many more Sarahs. As Andy Bassier put it, the Medicaid cuts will be devastating. Huge Medicaid cuts will wipe out rural health care across America, and that's not an exaggeration.
Vermont law already requires health care for everyone in the state. Quote, "Vermont must ensure universal access to and coverage for high-quality, medically necessary health services for all Vermonters. Systemic barriers, such as cost, must not prevent people from accessing necessary health care." Let's give Governor Bassier the last word on why select boards and all citizens must stand up and speak out in opposition to the mandated Medicaid cuts.
Where are you looking to triage the most?
Well, the Medicaid cuts would be devastating.
That's the biggest one.
Huge Medicaid cuts will wipe out rural health care across America, and that's not an exaggeration. It will wipe out rural health care.
Will you have to try and make that up financially to provide them, or does that just go away?
We will try, but the numbers are enormous.
Okay.
The numbers that would be required there would tax the rainy day funds of states very, very quickly. You know, Medicaid is a part of our healthcare portfolio, and it's going to need to be a part in the future. John, I think how we change the trajectory of what we're seeing right now is getting individual Americans to speak out. Everybody's got the cell phone, everybody's got the camera, and everybody's on one of these social media platforms. It's videoing how much more your groceries cost. It's showing that facility that's shutting down.
Testimony.
Exactly.
You're asking for testimony. I think that's wise. Witness and testimony.
Well, I got to have this amazing experience. I got invited to Selma for the 60th anniversary of Bloody Sunday, and I got to talk to some of those brave foot soldiers that are still here. And it just hit me that there wasn't one person speaking out. It was a collective courage that just changed the world in such an important moment.
Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. Margaret Mead, anthropologist.